My name is Victoria Knight, and welcome to episode 4 of Vet's Eye View. We have many topics today to discuss about preventative care, and also we're going to go into many details about taking precautions when it comes to the Halloween season coming up. So before we head inside, be sure to like and subscribe to our YouTube channel and our Facebook page, and I'll see you in there.
I won't need to take his halter off yet.
Oh, but, that's fine. He's really easy to get it back on. It's not like...
He's easy going with everything, it seems.
And then...
I'm listening to his heart and lungs and make sure I know how they sound.
Yeah, after his dental issues, like we didn't...
What was that?
I said after his dental issues, he hasn't had any...
Okay.
Yeah.
Yeah, surprisingly not a lot of congestion in the lungs area.
Yeah.
I'm going to take his temperature, which I know is going to be the top of his fun list.
Like a boy.
But it's also part of the top of the important list.
So we had Cowboy just in. What was his diagnosis for today?
He has respiratory difficulty of one form or another, and we don't know exactly what's causing it. But with the x-rays that we took, we ruled out a number of different things. And what we're left with, it might be a little overreach, but what we are left with is the suspicion that inflammation is playing a role here. We do know that inflammation can be related to asthma, where the body is just not tolerating things that are in the environment, and there's a reaction going on. And if we tell the immune system to settle down with medication that can work, we also know that heartworm, while that's an unusual thing in cats, can sometimes cause inflammation. Heartworm in cats is more of a respiratory disease than it is a heart disease. And so we won't have an easy way to figure out if that's the case, but we're going to use a medication to see if we get the response from the inflammation. That medication is what we gave in the form of an injection.
What is the reason for the x-ray? Like, what is that? What are you looking for when you see this x-ray?
I like to believe that our hands and eyes are able to figure out all things, but I know that there's a barrier between what we can see or feel or smell, or hear for that matter, but in some situations we have to look further. So I consider x-rays or blood work to be a window inside the body to be able to tell us what things are like going on inside. And so the x-rays are a way to not just respect the barrier that a chest cavity is, but rather to look inside of it. And so it tells us about the appearance of the lungs. There should be a certain density that's visible. It tells us about the size and the shape of the heart. And of course, if there's anything in there that shouldn't be in there, that's going to help us narrow down a diagnosis as well. So the reason for his x-rays was because we needed to make sure either that we knew what was the answer, or at least what wasn't of consideration any longer. So the x-ray does not show any fluid outside of the lungs, and the lungs themselves look as though there could be some inflammation in there. So I'm going to go with the thought and the presumption that this is an inflammatory condition. The antibiotic only helped because bacteria were involved, but were they the main thing or were they a side thing? That's the thing that isn't clear. But if inflammation is involved, I can use this other medication that basically controls inflammation. And it is sort of using medicine as a test where we're looking for what the response to that therapy is, but a positive response to that tells us that we're on the right track. So just so that you know, there is a diagnostic road where, fluid samples from the lungs, specialized x-rays, sedation for other views, etc. could be done. We're not going to do that right now, but I think we'll take an exit ramp to the diagnostic superhighway and see instead what the response to this treatment is. Yeah. So the clear discharge you noticed from the eye, and is that ongoing, or is that something that flares up at certain times than other times?
Just flares up occasionally, and it seems like when it happens, it'll happen for maybe like a week, and then it doesn't happen anymore.
Okay.
And it affects the good eye.
Oh, interesting. Okay. So right eye is the one that's been affected, but you'll notice the issues with the left eye then as well?
Correct.
Okay.
So, yeah, the eye that we are sure he can still see out of is the one that does the clear discharge occasionally.
Okay. Let's take a look at you, my friend. See how things are going. This is my lightsaber.
I know, but... okay.
Let's bring his head up just a little bit. I won't be able to free up for that.
Yep.
Do you believe there's any vision in the right eye at all?
We kind of gamble. There's a possibility there's a little vision there.
Okay.
It's okay,
Let's see
buddy.
if there's any constricting of the pupil on the other side. When I shine the light in on this side, the pupil does not constrict on this side. And knowing that there isn't a brain reason, but rather an eye reason, I would have to say the eye is not sending a message to the brain saying light is being shined here, which should cause the other one to constrict. But there is constriction when I shine the light in the good eye, so I know that eye is working. Just the communication or the reception of light in the back of the eye is probably not registering. Now that eye being smaller, that's what causes it to kind of recede a bit, and that's what brings up the third eyelid. There's no muscle in the third eyelid. It just, if the eye is smaller or pulled back, then the third eyelid comes up. And so that's all related to whatever the original issue was with that eye. And I can't recall at this moment, do we have an idea as to what started that eye situation?
Yes, so he was an outside cat, and he went missing for a few days. You know, he had just started to come sort of visit us, and he came back, and it was very clear to us that he had been bitten in the eye by another.
Okay. Yeah. Eye is very unforgiving to anything that enters it, and so when the infection and damage gets healed, sometimes the connections in the healing process make things stick together that should have stuck together. So the iris with the adhesions is basically the inflammation caused the iris, instead of smoothly moving over the lens, to actually get attached down so that there isn't any freedom of movement.
So I see that you just met with Mr. Gray. So what is the issues that he's having with his eye?
He's a really nice guy. He's a really nice cat. He had an unfortunate issue with an outdoor cat. He was a stray when he was adopted by them, and just beforehand he had been probably attacked or injured by another animal through a bite.
Wow.
And the eye has great abilities to heal, but it doesn't have great abilities to retain vision after an injury like that. And I think while the eye has healed, it caused enough damage that he is not able to see in that eye any longer. He has some connections. The iris is supposed to move freely in there, and because of the inflammation that occurred, then there is actually some attachments the iris has, so that it's almost like it's anchored down instead of freely moving. But more importantly is the retina, which is responsible for receiving messages and transmitting that. I don't think the retina is functional. So when I shine the light into that eye, typically that eye should constrict the pupil as well as the opposite eye, and it didn't do that. Whereas the other eye, when I shined a light in there, it did constrict and did not make the other eye constrict. So I think that eye is just not functional at all. Now their main reason for coming in today is, of course, this is hot on their mind because they've been aware ever since adoption a few years ago that this was of concern, but they noticed some eye discharge. Well, when you hear hoof prints or hooves, it's not always horses. Sometimes it's not always zebras. Sometimes it's a horse. And so what I described to them is that that this could just be an incidental inflammation in the eyes rather than related to this previous issue. But the cool thing is that there wasn't much inflammation there calling for treatment. Everything seemed functional otherwise. And when discharge from the eyes is clear, then I sometimes think it's either an irritant, maybe a virus. He does go outside, but mild nevertheless. And since most of our medications fight bacteria and not viruses, it gave the option of allowing them to just let it run its course. It's periodic, and that was the decision today.
So with Halloween just being right around the corner, kids are going to go trick-or-treating, they're going to have their costumes on. What are some things that a pet owner can watch out for?
You know, candy is probably the biggest thing to watch out for. I mean, kids are not careful where they place this stuff. Families, having the baskets of food out as trick-or-treaters come by, that can be a big opportunity in a negative way for pets to get into this. And so chocolate gets the most notoriety, and of course chocolate is toxic to dogs. it's toxic to cats too, but they don't have the sweet tooth. Cats are more
Yeah.
at risk of wrappers and things that are interesting that they could swallow. But the chocolate itself has a toxin in it. Theobromine is an ingredient in chocolates that causes neurologic signs, respiratory signs, and in large amounts it can actually be fatal. So we want to make sure that pets are not having an opportunity to get into that at all. Keep those things up and out of reach. Make sure that you're aware, or maybe even have your pet secured in a safe room indoors while all this weird activity is going on the Halloween.
So when it comes to costumes, some people like to dress up their animals. So what are some precautions that they could take?
First of all, think about whether your pet really wants that or not.
Right.
And but then if you decide to do that, we want to make sure that it's done in a conscientious way to pets. There are some things like rubber bands and tight things that can strangulate skin. They can't really see all that well if their face is covered, and they can get themselves into accidents if they dart away because they're scared of the costuming that we've used. But as well, it just seems like sometimes they're just tolerating what we're doing to them rather than that we're doing this for them or with them. So kind of think through whether that's a beneficial thing.
Yeah.
The other thing about costumes, though, is that people getting dressed up in costumes, pets can't recognize familiar faces. And so many times this is going to strike a lot of fear as these people that don't recognize are coming to the house, or just the fact that more people are coming to the house. And so having a safe room for pets is also important in that regard. But if you take your dog out during this time period, yes, the neighbor girl who always loves on your dog may be interested in coming up, but she's wearing some different costume, dog doesn't recognize, gets scared, bites can occur. So we want to make sure that we're not putting children at risk, let alone pets.
Okay. So candies, costumes, is there anything during the Halloween season or any holiday season really that you need to look out for?
This is timely to think about fire risk, and so we have these jack-o'-lanterns, candles inside pumpkins. It might be curious for pets to explore these things, but they can also knock over these pumpkins and start a fire. I really like the battery-operated, I guess they're little tea light things. Those work better, but of course, if they're into chewing things, even the battery inside one of those is a little bit of a risk for pets too. So be smart about fire risks, and anything that we're dangling in the house is going to attract animals to chew on these, and ingestion of things that can't be worked through their digestive tract is a problem. Even lollipop sticks, they can get stuck in the roof of the mouth or be swallowed and cause an obstruction.
And I'm sure as well Halloween decor. A lot of people do a lot of the tall, big, scary images in their front yard, or even just hanging stuff in their window. Those items, I'm sure that you'll have to look out for as well.
Yeah, we just have to think through a dog's mind as we're going for walks in the neighborhood. These things make a lot of noise. They're huge, and dogs that are prone to anxiety like that, I've known them to develop permanent anxieties because of a negative experience. We always think, it's one day a year. How bad could it be? But sometimes a negative experience will remain with a pet because they don't know when the next thing is going to happen. And we don't want our pets to live with new anxiety. We want to have anxieties disappear and be gone for good rather than present forever.
Thank you for watching episode 4 of Vet's Eye View. If you haven't already, please like and subscribe to our YouTube channel and like our Facebook page. So hold on to your leashes, and we'll see you next time.